Hey there, my name is James Lee. Welcome to my channel 5149, where I talk business, politics, society, and today I want to talk about what the heck is going on. Part 3, we're talking about COVID-19 2022 edition. Is it still an emergency? Is it not? What's going on with the boosters, the variants? It's all very confusing. And my focus, of course, is going to be on examining the institutional hypocrisies and the potential corruption that is making it even more difficult to figure out what exactly is going on. First off, YouTube does not allow content that poses a serious risk of egregious harm by spreading medical misinformation about currently administered vaccines that are approved and confirmed to be safe and effective by local health authorities and by the World Health Organization. This is limited to content that contradicts local health authorities or the WHO's guidance on vaccine safety, efficacy, and ingredients. Those are the rules, but even with those rules, I think we can still have an interesting discussion here today.
Well, here we go again. Two new COVID variants are gaining ground across the globe, the BA 4.6 and BA 2.75. So what does this really mean?
All right, so on one end of the spectrum, we have the COVID is not over narrative. And there's certainly a lot of evidence to support this narrative. According to the Washington Post, about every 3 minutes last month, referring to August of 2022, an American died of the coronavirus. And for those who survive, potential long COVID awaits. One example, a study showed that 60% of people who recovered from COVID-19 had signs of ongoing heart inflammation, which could lead to the common symptoms of shortness of breath, palpitations, and rapid heartbeat. This inflammation appeared even in those who had a mild case of COVID-19 and who had no medical issues before they got sick. That's according to an article put out by Johns Hopkins Medicine. Those facts are undeniable. A not insignificant number of people are still dying, and for those who are infected and then recover, we're now discovering that there's a number of long-term health risks associated with COVID-19 infection that we still don't really fully understand. So perhaps it might be wise to continue to take precautions and allocate funding to things like testing and treatment.
Masks now officially no longer required on mass transit. That news coming from Governor Kathy Hochul just minutes ago.
It was there for the right reason. It protected health. And now we're in a far different place than we had been as we continue to watch the trends. This is not a one-day snapshot. This is watching the trends, and we're seeing a stabilization of those numbers.
Now, the other end of the spectrum, COVID is not really an acute infection anymore, and we should kind of do everything we can to get back to normal. Once again, there is data to support this narrative as well. Hospitalizations in general have leveled off and are only a quarter as high as they were at the peak of the initial Omicron wave and well below any of the pandemic's previous peaks. Dr. Anthony Fauci has also commented that COVID-19 will become more of an endemic situation in the US by December, meaning that the coronavirus can be treated more like the flu than a health emergency, and that COVID will become something we can live with and doesn't disrupt us. Okay, so those are the kind of competing two narratives that are out there. I suppose the one that resonates with you more is probably based on your own risk tolerance. But nevertheless, let's take a look at some official policies and guidelines to see if we can make a little bit more sense of this. Last month, the CDC loosened guidance on quarantining, social distancing for COVID-19. This is from Axios. The agency is relaxing both quarantine and social distancing guidance. Unvaccinated people who are exposed to COVID-19 are no longer advised to quarantine for 5 days if they have not tested positive for the virus or are not showing symptoms. The agency is also no longer emphasizing social distancing as a key method to reduce the risk of exposure. Screening testing of asymptomatic people without known exposures is also no longer recommended in most community settings, the CDC said. Quote, "The current conditions of this pandemic are very different from those of the last 2 years," said CDC epidemiologist Greta Massetti. I think a lot of people are down with these changes, the transition from a one-size-fits-all solution to letting people make their own individual choices when it comes to dealing with the virus, not entirely unreasonable. And the shift in guidelines from the CDC clearly indicates from their perspective that we are no longer in an acute emergency phase of the pandemic, at least from a public policy standpoint.
Dr. Paul Offit, an infectious disease and vaccine expert at the Children's Hospital of Philadelphia, he's also a member of the FDA Advisory Committee, has been critical of this updated booster. He says that a healthy young person really is unlikely to even benefit from a booster dose. It should be targeted more specifically to those who really are most likely to benefit. And I wonder if you agree with that assessment and whether just even saying that adds to what's been, as you know, an ongoing criticism of CDC messaging that COVID vaccines, COVID itself, the messaging has been confusing.
So first, deep respect to Dr. Offit. Here's what I will say about our updated vaccine. We are simplifying our message. The message is you need to get your fall booster vaccine. So go ahead and get it. If you're over the age of 12, if you've received your primary series, if you're more than 2 months out of your last shot, you can get an updated vaccine. And so we've intentionally simplified the message so it's very, very clear.
Ooh, that's not nuanced. A press release from the FDA on August 31st, 2022. Today, the U.S. Food and Drug Administration amended the emergency use authorizations of the Moderna COVID-19 vaccine and the Pfizer-BioNTech COVID-19 vaccine to authorize bivalent formulations of the vaccine for use as a single booster dose at least 2 months following primary or booster vaccination. To me, this is the big incongruence. Right now, it seems that at every level of public health, federal, state, local, we are no longer treating COVID-19 as a public health emergency. There's even this kind of hilarious tongue-in-cheek you do you mass guidance just released by New York's Metropolitan Transportation Authority. But for some reason, both the updated Pfizer and Moderna vaccine boosters have been granted emergency use authorization, and we are told by the head of the CDC that everyone over the age of 12 should get one. The Food and Drug Administration is expected to authorize new COVID-19 booster shots this week without a staple of its normal decision-making process, data from a study showing whether the shots were safe and worked in humans. Instead, the agency plans to assess the shots using data from other sources such as research in mice, the profiles of the original vaccines, and the performance of earlier iterations of boosters targeting older forms of Omicron. Quote, I'm uncomfortable that we would move forward, that we would give millions or tens of millions of doses to people based on mouse data, said Paul Offit, an FDA advisor and director of the Vaccine Education Center at Children's Hospital of Philadelphia. Once again, I cannot comment on vaccine efficacy, nor do I have enough expertise to say whether or not it is a good idea to roll out a vaccine to the public that has yet to complete human trials. It may very well be appropriate, but what I can do is observe the disconnect, the oddity of releasing a vaccine without human trials under emergency use authorization, even though the CDC, along with state and local public health guidance, suggests that it's not an emergency right now, all the while suggesting that everyone needs to get it. So what the heck is going on here? How serious actually is the risk of COVID-19? In my opinion, very difficult to tell. But here's what I can report. Since the CDC Foundation was created in 1995, hundreds of corporations have contributed to public health programs for a total of $161 million in donations. That sounds like it could be a conflict of interest. In fact, there's reporting back from 2016 that a dozen senior scientists have reportedly lodged an ethics complaint alleging the federal agency is being influenced by corporate and political interests in ways that shortchange taxpayers. Last year, we had corporations publicly lobbying the CDC to revise and shorten isolation and quarantine guidances to alleviate workforce shortages. This should not be happening. This conflating of economic and scientific rationale when justifying public health policies, which will definitely cast doubt and erode any public trust going forward anytime the CDC gives a public health guidance. What about this alarming headline from Forbes? The biopharmaceutical industry provides 75% of the FDA's drug review budget. So the regulators in charge of approving drugs are paid for by the people they are supposed to be regulating. That's a problem. In fact, the former head of the FDA, Scott Gottlieb, is on the board of Pfizer. What is that all about? I think no matter how you are dealing personally with COVID-19, whether you're one of those, it's not a big deal, let's get back to normal, or whether you are immunocompromised and want more restrictions in place that prevent spread, the one thing that's clear to me is that we are far from a nation where our leaders have the best interests of the citizens in mind. The private sector only cares about profit, and our government and other public sector institutions are completely beholden to the profit incentives of the private sector. To paraphrase Mussolini, fascism should rightly be called corporatism, as it is the merger of corporate and government power. That's, I think, where we are today. I know Biden just gave his speech on saving the soul of democracy or whatever he's calling it, but our current dynamic where society and the economy is organized in such a way where the government and corporations walk hand in hand, that is the biggest threat to democracy, if we can still call the US a democracy. If they really cared about public health, the solution wouldn't be just take this vaccine, which so happens to make billions for manufacturers. Pfizer projects $54 billion in COVID-related sales this year, which is about half their total revenue. Money that just so happens to also flow back to the CDC and the FDA. Cutting quarantine times, that we can do because it would directly benefit the economic machine, but doing something else like improving our access to healthcare, that can't be done because it would directly threaten the existence of our for-profit insurance and hospital system. My point is, whatever the truth is, nobody in power has your best interests in mind. I know that conclusion isn't exactly satisfactory, but that's what I hope a community like we're building here is going to help us do, which is to collectively determine to the best of our ability the truth and what solutions we can implement that puts the interests of people before profit. I hope this helps shed some light on what the heck is going on. Do you agree, disagree? Let me know what your thoughts are in the comment section below. I'm looking forward to reading these because I'm sure there's going to be some diverse perspectives out there. Anyway, if you want to support me and this channel, please click on that like button, share this video, consider subscribing, clicking on that notification bell icon so I can keep making more of these videos. Let me know what else you want to hear about. And as always, thank you so much for your time. And I'll see you next week.